Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancering Show. Welcome back to The Cancering Show. This is Jennifer Pierce, and I am so excited to be coming to you from the studio today to answer our listeners' questions. All of you have been writing to us, and we've got a long list of questions. We're going to try and get through some today, and we'll save some for a second show towards the end of Season 3. You all know our season has been about community and the community of cancering, and we couldn't think of a better way to respond to our community by getting your questions directly and getting you the answers that you need to prevent cancer, to fight cancer, and to be cancering in the best way possible with the longest life and the highest quality of life. So without a lot of fanfare, we're going to jump right in. Question number 1, are sunscreen sprays effective? Which sunscreens are the best? And does sunscreen even work? So first, I want to say that yes, sunscreen is effective and it works and you should use it. I don't recommend a particular brand, but there are some rules to follow when you're choosing a sunscreen. It needs to cover both UVA and UVB light. It needs to be waterproof, because even for those of us who are not doing water sports, you will sweat when you're out in the sun. So you look for something that's waterproof. You also want to make sure that it's at least a 30 SPF or higher, and that you realize it only lasts for 80 minutes. Lastly, and this seems dumb, but of course we all know it only covers the parts that you put it on, and every other place where you are not covered by sunscreen, including maybe under your vented hat, or even on the tops of your toes and places like that, tops of your ears, if you're wearing a baseball cap, are not being protected from the sun and could be getting a dangerous amount of sunlight that in years from now could cause skin cancer. So we really want you to cover up those areas that are not getting sunscreen and to avoid the sun and direct light in the heat, especially of the afternoon, as much as possible. But yes, we strongly encourage sunscreen, and it's a great way to prevent skin cancer. Our next listener writes, early detection seems to be an issue. Why not just pay for a total body scan every few years? First, to answer this question, I really want to focus on the fact that when we are looking for early detection, we're looking for microscopic cancers or microscopic precancers that you actually can't see with the naked eye and would not show up on a scan. This type of early detection is how we identify something so early that it is easily curable or easily removable. For example, your Pap test is looking for microscopic precancerous cells or even very early cancer cells that we can't even see with the naked eye during a pelvic exam. Your colonoscopy is looking for polyps that again might have precancer or even very early cancer cells that they can remove at the time of colonoscopy that would never show up on a scan. Even a mammogram is looking for tiny calcifications just as they are starting to form a cancer before it would ever show up on a scan. So when we're recommending scans as part of a cancer workup, we're really looking for the presence of disease or the presence of cancer spread, not the absence. The last thing is really making sure that you understand that early detection is just that. It's detecting cancers, and it's not the same as prevention. We really want people to be proactive and to keep doing those behaviors that actually prevent up to 50% of cancers. Next question, this one from my 8-year-old. How does cancer cause you to lose your hair, and do people shave their heads because they are sick? I love this question. It just speaks to the innocence of children and how they perceive what is actually going on around them. Many of you know that the reason cancer patients lose their hair is because traditional chemotherapy kills all rapidly growing cells. So our cancer cells grow very quickly, and because of that, any medicine that kills rapidly growing cells can be used as a chemotherapy. And in that way, it also kills hair follicles, the lining of the GI tract, and can cause other changes that we see commonly like anemia, low white blood cell count, and other low cell counts associated with that turnover of those rapidly changing cells. But when we see that hair falling out, some patients actually shave their head because it can be pretty messy to be losing hair all the time. And so a lot of what our children see are people shaving their head at a moment when they actually are losing their hair. And then this happens around the time of the second chemo treatment. It actually doesn't happen right after the first treatment, but around the time of the second chemo treatment, most of the hair starts to fall out and people shave their heads to make it more comfortable, more clean, or just to have it be all in one go. A lot of times people shave their heads to support a loved one who's going through chemotherapy. They might not actually be going through chemotherapy themselves, but this is why we so often associate a bald head or someone with a shaved head with the diagnosis of cancer. The other thing I want to point out is there's a lot of people getting cancer treatment these days who look totally normal, who may not have lost their hair at all, who might be getting immunotherapy like our recent guest Helen Bender, or hormonal therapy or other targeted therapies that are not going throughout the body to kill hair follicles and other cells. So these days, it's really hard to tell who's getting cancer treatment or not. And it goes back to what I always tell my 8-year-old, you just never know what somebody else is going through, and everybody needs a little bit of kindness. Next up, a listener writes, are there specific foods or drinks I should avoid while undergoing cancer treatment? The first thing I want to point out is that we have a wonderful episode to refer you to get more information about what to eat and drink on cancering. That is episode number 29, Sink Your Teeth into Culinary Medicine with John Wesley McWhirter. I really want to point out that yes, there are specific foods and it's not as big of a category as you think. First, we want you to eat healthy, but also to work on not losing weight when you're on cancer treatment. So that sometimes means we sacrifice some of the healthiest foods in order to make sure that you're getting calories in. Next, in terms of getting calories in, a lot of patients find that adding a protein drink or protein shake can help them to get that necessary vitamins, minerals, and proteins that they need while they're on chemotherapy. And third, we tell you to look at your plate and make sure that it's divided 4 square, half fruits and vegetables, and the other half grains or carbohydrates and protein. So that way you're not getting too much of any one thing and you're getting lots of fruits and vegetables. As to what to drink on chemotherapy, we tell patients over and over to drink as much water as they can to stay really well hydrated. Some types of cancer treatment can cause you to lose electrolytes if you're having a lot of nausea and vomiting or diarrhea. And in those cases, we definitely want you to drink electrolyte-rich drinks like a Gatorade or Powerade type drink, or even a Pedialyte. In other circumstances, that's not quite as important, and you can drink whatever tastes good within reason. But we do counsel patients that drinking caffeinated drinks actually takes away from your hydration, and we want to encourage people to have at least 1 glass of water for every caffeinated beverage. Last but not least, most of the time we counsel patients to avoid alcohol and to let their doctors know of any other substances that they might be taking. But do work with your doctor on this recommendation because there are unique circumstances surrounding every different type of cancer treatment. Next up, from one of our out-of-town listeners, given the vaccination to prevent cervical cancer, what is the expectation that we will see this form of treatment to protect against other cancers? And if so, which ones? So first, I would say yes and no. There is a difference between a preventative vaccine and a therapeutic vaccine, and let me just go into that quickly. Of course, for a preventative vaccine to work, most of the times that means that we know the causative agent of that cancer. And most of the time that means that the cancer is caused by an infection because the vast majority of our preventative vaccines are to prevent infection. So there's two that come to mind immediately. The hepatitis B vaccine that's been recommended since 1992 and been given to newborns since the early 2000s. The hepatitis B vaccine actually protects against liver cancer because hepatitis B is a common cause of liver cancer. And so by preventing infection with hepatitis B, it also has the added benefit of preventing infection. The same is true of the HPV vaccine. The HPV vaccine was first FDA approved in 2006 and has been available to prevent up to 6 different types of cancer since that time. We recommend it to be given in adolescents at a routine adolescent vaccine visit and can be started as early as age 9. And it protects against HPV, which is the causative agent in head and neck cancers, cervical cancers, as well as 4 other types of cancers in men and women. So those vaccines prevent cancer by preventing the infection that causes the cancer. However, there's an entire field of research that is so exciting surrounding therapeutic vaccines. Now, this is utilizing the science behind a vaccine, meaning that we expose your immune system to a little bit of a foreign substance or a foreign material or something we want your immune system to attack. And then we partner that with an adjuvant. That's a chemical that's used to stimulate your immune system. And those two things together allow the immune system to recognize and then attack what is labeled as a foreign substance. The difficulty with cancer is because it is of the body, it is of the self. It is one of your own cells that has turned into a problem. It's very hard for our immune system to recognize that as foreign and to seek and destroy those cancer cells. And so these therapeutic vaccines do allow our immune systems to be stimulated to hunt down cancer cells and to kill them. Therapeutic vaccines are now in phase 3 trials in several different cancers, including ovarian cancer. We're very proud of a trial that was initially studied at the Mitchell Cancer Institute in ovarian cancer, and that vaccine is now in phase 3 trials. Vaccines for therapy for cancer are often used more in maintenance than in treatment, but there's so many different ways that this technology can be harnessed in the future, and I think we're going to be seeing increasing amounts of utilizing our immune system to fight the cancer rather than outside drugs. Another question that gets back to just what we were discussing earlier about prevention. What's something other than smoking, but maybe not as obvious as a healthy diet to avoid random cancers? Now, I think this person is thinking about random cancers in the sense that it's not something maybe that's in your family. And of course, we want to talk first about the fact that knowing your family history, knowing if there's any cancers in your family that you might be at increased risk for that might actually change the way that you are screened differently from someone who maybe doesn't have cancer in their family. And so knowing your family history is definitely on the list for cancer prevention. The next that we think about is sunscreen. The number one, quote, random cancer is skin cancer. Anybody can get it who has had a significant amount of sun exposure, and unfortunately, some of those skin cancers can be life-threatening, particularly melanoma. And so we always want to protect ourselves from the sun. Every person gets sun exposure, and a lot of people get unnecessary or unknown sun exposure. So doing your sunscreen, wearing it every day, is going to be a great way to prevent those cancers. They mentioned in the question not smoking and eating a healthy diet. Let's just focus on those two for just a minute. Of course, we recommend avoiding any tobacco products. That includes vaping and chewing tobacco, which have also been linked to cancer. And if you are needing information on quitting, we recommend that you call the Alabama Quit Line or your primary care doctor. They would be delighted to help you get started on the road to quitting. There's no day like today to get started on that road. We've talked about healthy diet several times, but the other things that we talk about are avoiding stress and inflammation. How do you do that? By finding the ways that you can become well, that you can lower your stress levels. Avoiding inflammation includes things like maintaining a healthy weight, avoiding unnecessary exposure to chemicals, and working on preventing exposure to environmental factors. Yes, what you put in your body matters, and remember that what you put in your body might actually stay in your body. So thinking about all the different ways that we can be exposed to things and looking to cut down on that exposure. I like this question, but it does go back to something that we're hearing repeatedly from our listeners. Does a plant-based diet decrease your chances of getting cancer? The short answer is yes. Red meat in particular is associated with a higher risk for cancer, but I also want to point out that just a plant-based diet doesn't necessarily mean that you're eating healthy. People can have a plant-based diet that includes all kind of junk food. And I never forget the time somebody told me, Oreos are vegan. Eating a healthy plant-based diet means eating plants that you can recognize, not just meat substitute, plant-based cheese substitutes, and all other kinds of processed foods. Even if it's plant-based, if you're at a fast food restaurant, it's probably not as healthy as they say it is. And it really means getting back to basics, eating more plants than animals, eating a wide variety of plants and fruits based on their colors, eating the rainbow, and preparing them in a way that is healthy, that has minimal additional additives or chemicals. This is a basic one, but a very good one. What is cancer screening? And I think this gets back to the question we discussed earlier on scans. Cancer screening is looking for cancer that is currently asymptomatic and undetectable on physical exam. That means that we go one step further than what we would normally do as part of your routine physicals to look for cancer. So for breast cancer, that's a mammogram. For colon cancer, that's a colonoscopy. For cervical cancer, that's a Pap test and an HPV test. And for lung cancer, that is a yearly spiral CT for those people at the highest risk. Now, you might have noticed there's a lot of cancers I did not mention. For example, prostate cancer screening is recommended sometimes in specific individuals who might be at elevated risk and is worth a discussion with your doctor. There are other cancers for which there is not an early detection test. And there are some cancers that we don't screen for. I'll give you an example. We don't screen for childhood cancers. They're incredibly rare. The likelihood of finding one when children are so young would just cause so much unnecessary testing and put children through incredibly invasive tests. We also don't routinely screen for blood cancers. However, every time you get a blood test from your doctor that checks your blood cell count, that is something that could pop up. So that in its own way does count as screening. This one came to us from the Facebook page. How do you know when to worry about a cyst? A cyst can mean all kinds of different things. First, it depends on what location we're talking about as to whether or not it's a risk for cancer. Cyst is just a fluid-filled sac. A lot of times it occurs in places that already have glands. So, for example, you can have a cyst on your breast. You can have a cyst in your ovary. You can have a cyst in your cervix. You can even have a cyst in one of your tonsils or salivary glands. And at the time that it is visualized, a lot of times we're going to check different things to see what is the risk of cancer and whether or not we're worried. The vast majority of asymptomatic cysts are not cancer. That's the first thing. We ask you if you even know it's there or if it was something that was found on a scan or routine imaging for something else. Next, we're going to look at the size and the location because an ovarian cyst of 5 centimeters might not be worrisome, but of course, a 5-centimeter cyst on a kidney might be more worrisome. So size matters, but it definitely is in relation to the organ in which we're talking about. Next, we also look at complexity. So when a doctor ultrasounds a cyst, and I will say that While cysts can often be diagnosed on a CAT scan, most of the time we're going to be evaluating them by ultrasound. And that's just because ultrasound is such a great way to evaluate water-filled objects. You'll know this because we always ultrasound pregnancies, which is just a baby floating in water. So we're going to ultrasound your cyst, even if it's a tiny one in your salivary gland, and we might look at the complexity, meaning is it just a simple water balloon, or does it have walls or nodules or blood vessels inside of it that might increase the risk that there's something more dangerous? A lot of times we will aspirate the cyst, and that just means draw all the fluid out of the cyst. That might be both diagnostic, meaning we can tell whether or not it's cancer, as well as therapeutic, because it means the cyst goes away. So when we worry about cysts, most of the time we're going to take them out surgically, and we like to make sure that we get the complete cyst out, including the wall. And if we're not too worried, sometimes the cyst will get followed over time with a repeat ultrasound or repeat imaging of some kind. And if it is stable in size or complexity over time, then it's probably nothing to worry about. I want to end with a very personal question to me. I get asked all the time, how do you keep doing this? And I don't think they're talking about the podcast, because while it is a ton of work, it's also a ton of fun. But I think people mean, how do I keep doing this as a cancer doctor? How do you keep showing up when people get bad news or have metastatic cancer or go on hospice, and that some of our patients are going to pass away? And I will tell you, and I think you've seen this and heard this in the podcast, that there's so much happy. We cure cancers too. Imagine the elation of a patient learning that their cancer has been cured. There's so much light and love in what I do. Watching the love between a couple as they support each other, watching the love in a family as parents take care of kids or kids take care of parents, and just being a part of people's really important moments, hearing people's stories and knowing that all of this is just part of the greater fabric of their lives. It's not the thing that defines them, but getting to know who people really are and seeing their strength and grace and dignity in those moments makes all of this worth doing. And the last thing I would say is that my job teaches me more than any other job that those special moments you have with your family really matter, and that the time you have with the people that you love really matter, and that the time you have to do something you love, to help people, and to really give back to our community and to people who are really going through a hard time in their life makes my time valuable and makes my moments valuable. And that's why I keep showing up every day, because it matters. And as we have said over and over in this podcast, cancer and a cancer diagnosis is not a death sentence. It is moments of great struggle. And of course, it's hard, but there's also times when we deliver remission or a cure or great news for more time, even if it's limited. And we are here to demystify that, to make sure people understand all the reasons to be hopeful and joyful while they're cancering. Thanks again for listening. This show is brought to you by the University of South Alabama Mitchell Cancer Institute. MCI is a cutting-edge cancer research and patient center built to fight cancer smarter in Mobile and Baldwin County, Alabama. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment population of more than 4.1 million people, with a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond, with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or search for us on Facebook, Twitter, and Instagram. Mitchell Cancer Institute is a member of USA Health. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.